Good afternoon. Thank you for joining us today on this Facebook Live. We do apologize for not being able to come to you from our normal setting where we typically have our 2:30 press conferences. We did have an accident on High Street earlier today, and it put down the power to several of the state office buildings. But I'm sure they're getting that back up and running, or if they haven't already, they will very soon. But we just thought this would be an opportunity to sit down with you and just have a real conversation about the numbers and where we find ourselves. And we continue to see positive, favorable movement in our coronavirus numbers. And the way in which we ought to approach that is what we are doing is working, but now is the time to redouble our efforts, to work even harder, to make sure that we're doing the things that we need to do, to make sure that we're wearing masks when in public, excuse me. Also, to make sure that we're maintaining social distancing, because when you're in a situation like we were in late June and July, when you're going up and up, you're trying to find ways in which to slow the spread and to roll it over. Now we have rolled over a bit, and it is now time to really crush it, to do everything we can to really minimize the community spread, because if we can minimize the community spread, then we can significantly reduce the risk in places like nursing homes. We can significantly reduce the risk in places like schools, because in many of the cases that we've had in our schools, in our nursing homes, it's because it wasn't because the first person got it while in those facilities, it's because they got it in the community, and then unknowingly, in many instances, they then took it into their either their nursing home from an employee, or into the schools either by a staff member or by a student. And so if we're going to be successful at keeping our kids in the classroom, and I really believe that we will be able to do so, the best way to do that is to drive down community spread so that we have fewer and fewer people in our communities that have the virus. So the fact is that today we're reporting, I get this right, 612 new cases today, and sadly 22 new deaths. Now let's talk a little bit about that. We know that both hospitalizations and deaths are a lagging indicator, and so the people who are getting put into the hospital today probably contracted the virus a week, 10 days, maybe 2 weeks ago. The people who are sadly passing away from this horrible disease, in many instances, actually got the virus 4, 5, 6 weeks ago. We know that the average stay in an ICU bed in Mississippi with the virus is somewhere between 21 and 25 days. So it's about a 3 to 4 week process in many instances before one either gets better or unfortunately in some instances does not. And so I want to make sure that we understand that when we look at hospitalizations and we look at the total fatalities caused by this terrible disease, that we understand that those are lagging indicators. What we're seeing in terms of new cases is encouraging news. But let's remember, why is it encouraging? It's encouraging because our strategies of wearing masks, of socially distancing, of not going into large groups, those things work. That's what we're learning more than anything over the last 6 to 8 weeks in Mississippi and really across the Southeast, is that if we will do the little things, it can make a huge difference. I did want to point something out. If you look at the data that we are looking at, again, this is data that is completed from a week ago, but we look at total number of cases over a 14-day period. We also look at how many cases per 100,000 residents. If you'll recall, that's the data that we utilized to make decisions on mask mandates in certain counties. When we started with 13 counties, ended up at 37 counties, and now we're at all 82 counties. Just a few counties that I want to mention. Again, I think we're seeing significant downward trends in many places, but I do just want to mention that we've got more work to do based upon the data in Bolivar, in Forest, in Jones, in Lee County, also in Panola County. We've got a little more work to do there. We've got work in Union County. We're actually seeing positive transmission in Union County over the last several weeks, and so I want to just highlight those counties so that I can reiterate that if you're a local elected official or an individual, let's work even harder to make sure that more of our people are wearing masks, that we're adhering to the guidelines, that we're actually reading the executive orders and know what they are calling for. But again, that's Bolivar and Forest and Jones and Lee and Panola and Union counties in particular. Those 6 counties, the transmission rates have slowed there, but they are continuing to be positive. In many other counties, almost 70 counties around our state, we're actually seeing declines in numbers, and that's an exceptionally positive trend that we got to build on. That is the reason that you'll see us over the next several days probably come out with guidance as it relates to extracurricular activities at our schools, particularly high school football games, etc. As I have said yesterday and for many days on end, I believe that we can play sports. We can do it in a safe way. And the way to do that is by limiting crowd size. And so we've already made some pronouncements as it related to youth sports like baseball, like soccer, etc. But now we're going to do the same thing as it relates to our extracurricular activities, our sports in our K through 12 schools. And I think will apply to both public and private schools because our goal is to protect everyone in our state. And the way in which you do that is by limiting crowd size, by ensuring that people are socially distancing. And the way to ensure people are socially distancing is by limiting the crowd size, and then also by making sure that people are wearing masks so that we're not spreading the virus unknowingly in many instances. So I want to complete today's Facebook Live by thanking you for joining us. We're going to continue to have conversations as we do every single day with our public health experts. We're going to come back to you live tomorrow at 2:30 in our normal press conference setting. I look forward to seeing you there. We'll give the press an opportunity to ask as many questions tomorrow afternoon as they want to. And I just want to say this. Thank you for what you are doing. If you would help us, if you would spread this Facebook message to the masses, if you would tell people across Mississippi, hey, I watched the governor today and we have really good news, really good things are happening in Mississippi, but we got to keep pushing hard. If we'll do this between now and the end of August, I think we'll all be exceptionally pleased with our numbers when we get to that point, which will give us even more confidence that we can continue our economy going, continue to get our kids back in school, and continue to move to what I hope is a more normal fall, similar to the 2020 fall rather than the 2019 fall rather than the 2020 spring. But the only way that's going to happen is if we continue to stay diligent, if we continue to work hard. So that's what I'm asking you to do today on Thursday is let's work, let's tell our friends and our neighbors that what we are doing is working, the numbers are coming down, let's be happy about that, but let's not rest, let's not ignore it, let's fight to continue to crush this virus. To all of my friends out there, Republicans, Democrats, those in rural areas, those in urban areas, let me just say this. This virus doesn't care. This virus does not care who you voted for in the 2016 elections. Now, there's no doubt that the 2020 elections coming up and some of the things that some of our political opponents say certainly doesn't help. But the virus doesn't care. It's being spread by Republicans, it's being spread by Democrats, it's being spread by independents. And so what I say to you in closing today is this. It doesn't matter what your political affiliation is. Our enemy is not one another. Our enemy is the virus. Let's work together to crush it. Thank you, Mississippi. God bless.